manage the market. Hello, and welcome back to the UFred10 podcast series. If you're joining us for the first time today, my name is Sarah Chesson, and I manage the Marketing and Communications Department here at the University of Fredericton. So joining us today, we have Michele Chase. Michele completed her advanced certificate in psychological health and safety in the workplace at UFred in 2016. So with over 18 years of experience in occupational health and safety, Michele has held many different positions within the industry, including her present role as an occupational health and safety officer at the British Columbia Nurses Union. Michele is also a member of the Canadian Society of Safety Engineers and the Healthcare Safety Professionals Association of BC. In addition to her advanced certificate, Michele is actually a current student working towards her Master's of Business Administration here at the Sandra Moen School of Business with a specialty stream in health and safety leadership. So welcome to the podcast, Michele.
Thank you. It's nice to be here.
I'm glad. So just to get started here, do you mind telling us a little bit about yourself, Michele?
Sure, yeah, that's not a problem. So as working for the British Columbia Nurses Union, I live in the Greater Vancouver Regional District, and I'm not going to say because we're buried in snow right now, but in a suburb called Port Coquitlam. So I do work currently as an occupational health and safety officer for the union. I have worked as a safety advisor for health authorities as well, and my portfolio currently is managing violence prevention and advocacy for the 43,000 nurses of British Columbia. I've actually, in addition to just working in occupational health for 15 years, I've worked in healthcare for over 25 years. That's sort of my industry sector, I guess you could call it, and also being a chartered professional in human resources for the last 7 years as well. So, yeah.
Wow, that's a big role. I'm wondering, Michele, what was it that drove you to continue your education at UFred then?
I would say that with the long history of occupational health clinic exposure I've had, so going back 18 years, I used to work for quite a long time with occupational physicians, and this is in a sector where you're dealing with occupational disease after the fact. So we used to work with employers who are managing exposures from things like asbestosis and cancers in firefighters. And we did medical screening and surveillance medicals, but this was all after the fact. So what led me to kind of advance my education in occupational health and then, of course, looking into psychological health was preventing these occupational physical, chemical exposures before they actually happen, rather than dealing with it from a after-the-fact response perspective. So I started to look into the occupational health and safety prevention side of it, and then the area of safety that continued to fascinate me, even in doing my certificate in health and safety, was how workers interact with the environment and the human and psychological factors that contribute to workers making the decisions that they do in complex environments, which might contribute to incidents or accidents.
That's really interesting. So have you found that your education at UFred has helped you to be more proactive instead of reactive, do you think?
Absolutely. Even the occupational health and safety education that is currently taught in most of the colleges and universities is it's very much environmental cause and effect driven. So what I like to call still sort of a Taylor Fordist philosophy, and I don't think health and safety has really grasped moving forward into looking at human and ergonomic factors as deeply as they do into causational factors. And what I mean by that is in complex environments, like an environment where I work, like healthcare, the importance of ensuring that things go right and ensuring that workers have the environments that they can operate within and do the best work that they can in is so paramount to being able to make those right decisions in providing, care for patients. So you can't transfer the traditional industry occupational health and safety philosophies into healthcare. So the psychological health and safety aspect bridges that human factor gap, and it allows you to sort of find those intersections between the hardline sort of industry philosophies about accident causation theory and healthcare. For me, anyways, it's again, it's finding those intersections where people are interacting with people. We don't have people interacting with equipment. We don't have people interacting with buildings. We have people interacting with people. We have workers who are interacting with patients, and you have to look at it from a different perspective. And the psychological health and safety side of it, and connecting the psychological health and safety with the causation theories in health and safety. So connecting it with the organizational systems approach to health and safety makes a really big difference in healthcare and how I approach, looking at healthcare for healthcare workers.
Absolutely. That sounds really interesting. If you, Michele, had to pick a standout moment from, or maybe a standout concept or something from your psychological health and safety education with UFred, what would you say that it would be?
I would say absolutely. Just realizing, so coming from a place where you've learned traditional occupational health and safety concepts, and a big part of that is accident causation and incidents and investigation. So finding out the root cause of why something occurred the way that it occurred and why it resulted in an injury or a loss, whether it was a loss of property, a loss of worker time, or an injury or loss of life, because that unfortunately happens as well. To be able to have some of these tools and practical ideas and resources, and be able to take that information back to the philosophies I learned in OH&S and actually say, aha, it was like, a spark moment. You can actually connect the dots here and relate it to healthcare, because again, that's my sector, that's where I work, and healthcare is generally quite resistant to traditional work-safe workers' compensation, because they think that it applies to industry. It doesn't apply to them because of the complex patient care environment kind of thing. So to be able to have those tools, those concepts, those philosophies, the information about applying those practical resources to connect it with occupational health and safety systems management was just kind of, it just blew it wide open for me. It just makes so much of a difference, for the advocacy work that I do, because it's not just about putting a piece of guarding on a piece of machinery. Again, you can't, the biggest thing in health and safety is if you can't, you have to mitigate the risk, and one of the mitigations is eliminating the risk. Well, you can't eliminate the risk in healthcare because we can't make the patients go away. So it's it's just, so again, being able to look at it from a completely different perspective and make those connections. Another piece that really drove me to pursue this further is British Columbia Health Employers. So that's the Health Employers of BC, the BC Nurses Union, or the Nursing Bargaining Association, came to an agreement. We actually wrote the Psychological Health and Safety Standard into our last round of agreement. All the health employers here have agreed to implement the standard by 2019.
That's amazing. It's so nice when you get those light bulb moments and everything starts to kind of come together. And it sounds like you are, but just to kind of discuss a little bit more. So are you finding that you are applying these principles in your day-to-day work then?
I am not specifically with the psychological health and safety yet because they're only in the planning stage, and I don't work for an employer. So when it comes to the actual implementation and evaluation stage, that will be where it'll make a difference for me. They're not actually going to be starting the implementation stage until April of this year. But aside from that, I still apply it because we traditionally, my job in advocacy is when there are incidents, and there are really terrible incidents that happen in healthcare. Most of them are violence related. Violence is a huge issue across the country and globally. Violence from patients towards healthcare workers and the catastrophic injuries that can happen. So when I'm asked to support our membership in finding out how and where things went wrong, I can use the psychological health and safety standard to compel the employer to look at other causation factors rather than stopping at blaming the worker. And we see that a lot. It's like, oh, well, she shouldn't have, he should have. Maybe if the nurse would only have done this, then this wouldn't have happened. And that's not a root cause analysis. That's stopping at worker blame. And so when I'm able to say, we need to look at different factors. We need to look at factors like fatigue. We need to look at factors like how healthcare workers feel about how they fit into being able to make their own decisions, being able to be part of the team, being able to contribute to the team environment of the workplace. Then you can start to dig down deeper and start to identify those systems issues rather than just stopping at blaming somebody for doing something wrong. So yeah, I use it all the time, and once the standard begins to be implemented with health employers in British Columbia, we have resource teams on the ground. We have a mental health strategy team that's involved in the implementation part. And once we get to the actual implementation and then the evaluation, that's where the standard or the education will help me to evaluate and help identify gaps and assist employers to correcting things that aren't quite working, perhaps.
Well, that's great to hear, Michele. So, you've touched on this clearly, but where do you see yourself going, either professionally, academically, that kind of thing, with this psychological health and safety education? Do you want to keep studying it? Do you see yourself doing more with it?
I see myself as continuing to develop, my career in occupational health and safety with an emphasis on the psychological health and safety factors, also the safety cultural factors, the idea of just culture, retributive culture versus restorative cultures in safety approach, and developing a strong safety culture in healthcare in BC. And I don't mean safety culture as far as patient safety. We already have that in Canada. I think we've got a pretty good, patient safety network. But building on the safety culture in healthcare for healthcare workers, and understanding that without strong worker safety, and that includes, not just the physical safety of the environment, but the psychological safety of workers who are in really difficult working conditions. I mean, you can't get many occupations that are any more stressful than working in healthcare, right? It's those human interactions. But to continue to develop a strong safety culture for healthcare in BC, for workers in healthcare in BC, and just continuing to build on health employers and understanding those human interactions, and working on, as I said earlier, their resilience in the workplace. Our organization teaches resilience, but so safety culture, just culture, and resilience, and then of course continuing with my EMBA as well, which
that's
at this pace is going to take me a while.
And that segues well, because I was actually just going to ask you, obviously we're quite proud to have reached this 10-year anniversary. We're ecstatic to be celebrating. So, and you've now completed one program with us and are working on completing a second. So is there anything in particular that makes you proud to have completed your education with UFred, or to be completing your education with us?
It's just personal achievement. It's, like I'm one of those people that's always going to be a lifelong learner. I'm not a full-time student. I hold a full-time job, but I'm a lifelong learner, and to to continue to challenge myself, challenge my own my own philosophies, and challenge my own learning and old theories, and and push those barriers. And that's for me. That's why I keep doing. And once I've completed, I feel like I can say that I've achieved, a level of sort of best practice, I guess you could say, in my chosen area, and continue to apply it to, the day-to-day work. It's not just learning something and putting a certificate on the wall. It's actually applying that knowledge, to the work that I do every day. And again, I work in advocacy work, so it's very rewarding to not be looking at it from the perspective of I have to do it as an employer because we must comply. It's done from a more moral and ethical perspective, that we do it because it's the right thing to do. And it's personal achievement in that area.
That's great, Michele. Before we go here, is there anything else that you'd like to tell us about your UFred experience?
Actually, yeah, I really enjoy, years and years ago, so going back to 2009, when I decided I did want to go back to school, I started with a different university in BC, and just because I know myself and I know my schedule and I know the demands of time that that are on me from my work and my family, I wanted to do an online learning platform, and I learned very well in that platform, and I really, really enjoy the system that UFred uses. I really like the way that all the resources are available and you can jump to them and they're downloadable. I've never found any kind of flaky or glitchy things about the online platform, and I have had to contact the tech support a couple of times just because something wasn't working right for me, and they were amazing. Just got back to me like immediately and sorted out what I needed to get done, and this is with a time change as well, because so I'm 3 hours behind. So even with the time change, I've just really enjoyed the platform, and I have confidence that whenever I log in to do what I want to do the work that I want to do, or read something or download a resource, that it's there and it's available for me.
Oh, that's great. I'm so glad, Michele. We've got a stellar tech support team here. You're not the first person to do that, so that's great. All right. Well, thank you for joining us today, Michele. I really appreciate it.